Welcome back to Inspire Great Health. I have Dr. John Knott from CRMG Orthopedics Surgical Specialists with me today. How are you, Dr. Knott?
Doing well. Yeah, thank you.
Great. Thank you for coming and joining me today. So we're just going to get to know you a little bit better. Why don't you go ahead and tell me about yourself, about your education, about your family, and where you're from?
Yeah. Basically, I was raised in Salt Lake, grew up in Salt Lake City, Utah. And then a whole long story as far as education goes. I don't know how much you want to get into that. But eventually did medical school at University of Utah, School of Medicine. And then I did my orthopedic residency training in Erie, Pennsylvania with UPMC. And then another year of specialty orthopedic training in sports medicine, a fellowship training year out in Orange County with Kaiser. After that, I came here, and I've been here ever since, so going on about 5 years now.
And what brought you to CRMG?
Honestly, I've got a wife and 3 teenage kids now. And so one of the biggest things that I wanted to look for as far as where I'd be working is what would sort of afford the best quality life balance. And honestly, let me be there as much as I can be for my kids. And so I really wanted to go somewhere that allowed for a lot of that life balance for me.
Well, we're great that we can provide that for you.
Yeah, absolutely. So far, it's been going fantastic. So.
Well, good.
Yeah.
Very good. And what made you want to get into orthopedic and sports medicine?
Well, it's quite a roundabout path for me. I don't have any kind of family that are in medicine or any doctors or anything like that. And so I really took a roundabout pathway for my education and tried to get a lot of experience. And realistically, I was thinking of going into woodworking and construction and everything under the sun. I was doing a lot of exercising and running and marathons and things like that. And so I started getting into the science of physiology and health. And then that just kind of snowballed, and then I kept going farther and farther. And eventually I learned about orthopedic surgery, and it really appealed to my mechanical nature and using hammers and chisels and screws and nails. That was right up my alley.
That's scary.
I know, right? It's the best part of orthopedics. And so, once I realized that I could do something that I really loved, working with my hands, and be able to interact with people and help people to get better, it was just a perfect fit. And so once I learned about that, it's just been nonstop going to school until I'm here now.
Okay.
Yeah.
Well, great. That's a great story. Thank you for sharing. It is a roundabout way of getting into orthopedics, but I think it's great.
Yeah.
And what are your areas of expertise?
So like I mentioned, I did that extra year fellowship training in what's called sports medicine. Sports medicine is a subspecialty of orthopedics. Sports medicine, it really kind of includes a lot of your general sports injuries, obviously, but a lot of people think of it more of like an arthroscopic sort of specialty. And so I do a lot of arthroscopic surgeries that's dealing with like knee meniscus tears, also dealing with like ACL tears, ACL reconstruction surgeries for the knee. For the shoulder, it's more of rotator cuff tears and shoulder dislocations, shoulder instability kind of pictures. But it also, a shoulder extends all through the life of the shoulder till eventually I do shoulder replacements as well.
And what do you find rewarding about your job?
Honestly, it's really being able to interact with the patients. One thing I really try hard to do is give a patient as much time as they need to ask all the questions that they want to ask and to get all the information that they want to get. I'm a big fan of patient advocacy, and I really appreciate when patients want to know about their injury or want to know about the surgery. It just shows me that they're that much more invested in doing what's right for them. And so anytime that I get to interact with those patients and be able to help them get all the answers that they're looking for, that's probably the most rewarding part for me is being able to see patients satisfied with their care and know that they're getting all the answers and all the time that they need from me.
You kind of already touched on this next question, but what would you want patients to know about your care philosophy?
Regarding like care philosophy, when patients come to see me, the biggest part for me with that initial encounter, like I said, is really making sure that I try and listen to them and hear what they're trying to tell me. Because a lot of times, you get a little bit of background information before you meet the patient, like their shoulder hurts or their knee hurts. And sometimes they'll even come with some, preconceived notions about what's going on based on other interactions with other doctors or with friends or even with the internet. And so, you really have to approach that first encounter with a completely open mind to what's going on rather than fixate on a lot of those information that you have, because sometimes you can be off a little bit in what's actually going on with a patient. And so if you don't sit down and really take the time to listen to what they have to say and sort out where their pain is coming from, why it hurts, when it hurts, what type of injury it was, if you don't go into that and listen to the patient with a fully open mind about what could be going on, then a lot of times you get really pigeonholed and start going the wrong direction, and patients get frustrated and they don't know why they're not getting better. And so it just ends up being a waste of time if initially you don't make sure that you really try and hear what the patient's trying to tell you.
I love that you brought the internet into it, because a lot of times people do try to diagnose themselves. So I'm glad, don't try to diagnose yourselves.
Well, I kind of, when it comes to patients looking on the internet, I think the internet is a fantastic resource. And I encourage patients to really ask those questions and look at things online. But you're right, you do have to be very, very careful about not trying to necessarily diagnose the issue, but absolutely looking online and trying to learn more about what the issue could be, or even trying to look up, what the anatomy of the shoulder is so that you could better understand where the pain is coming from and what structures are underneath there that can lead to that pain. But that, sometimes that can also be some of that white noise that you have to sort through when you first meet with a patient. And so that's where it's really important to just focus on, where does it hurt and why does it hurt?
And what do you think makes you unique as a provider?
One of the things that I pride myself on is trying to be as relatable as possible to patients. I really try and view them as I would, any one of my loved ones. So one of the ways that I'll explain it to patients is, the reality is that I have a pretty simple mind. Like, I understand things on a very basic level and then build from there. And so anytime in med school that I had to understand, physiologic processes or how drugs work or medications work, I could never just flat out memorize it and reiterate it. I had to go to the very foundation of how it worked, understand the process of it, and then from there, my brain can sort of figure out whatever needs to happen just because of understanding that basic, simple process. And so when it comes to orthopedic surgery, everything can boil down to a very simple, straightforward, logical explanation of what's going on mechanically. And because I understand it at a very simple level, it's easy for me to explain, complex things in a very easy way to understand, because that's how my brain understands it.
Some rapid fire questions that I have for you are, do you prefer beach or mountains?
I prefer mountains. My wife is very much a beach person. I feel like I've probably led at least 5 or 6 different lives up until this point. And so, a lot of my life I've been really into mountain climbing, ski mountaineering, and rock climbing. And so I've had a chance to climb and ski from a lot of really major peaks around the U.S. And so I'm a big outdoors guy. I really love the mountains. I had the opportunity to ski from the top of the Grand Teton and from Mount Whitney and Mount Hood and a lot of the peaks all around the Salt Lake Wasatch Range. And so, ski mountaineering has been a big part of ski mountaineering is something I love to do.
Okay.
I don't know what's been a big part of, but it's something I've always loved to do. But mountains.
Mountains, perfect.
Yeah. I actually did a lot of research in mountaineering too. So I actually had, before I went to medical school, when I was still sorting things out a little bit, I mentioned that I was really into exercise physiology. I had one of my professors after my bachelor's degree approached me about working with him for a master's degree in basically exercise science. But the reason why I wanted to work with him is because he proposed that he and I go climb a mountain down in Mexico. And I wrote a thesis off of altitude research with oxygen saturation on a mountain called Pico de Orizaba. And it was an awesome experience to be collecting data and write up this thesis on while climbing mountains. And I ended up earning my master's degree in exercise science out of that before going on to medical school. But that also led into, when I started medical school, I met up with a really well-known altitude researcher out of Utah who was working on a project that involved an arm at Everest and an arm at Denali, again, studying altitude and mountain climbers.
Wow.
And so he had me go to Denali, a little town called Talkeetna. And I was up there for a month collecting research data during one of my first years of med school. And so, that altitude, mountain climbing and altitude research was really a big part of my educational training before and through med school.
Well, that is very in-depth about altitude.
Mountains.
Yeah, mountains.
I love mountains. Yeah,
I think that's
great.
awesome.
Mountains are great.
Next question, cats or dogs?
Well, that's a tricky question. So we have 2 dogs and 1 cat. Probably on a day-to-day basis, it switches. Depends on which one is
Which
being
one's making you
nicer
mad.
and which one's being more annoying. I will say the cat tends to be much more annoying than the dogs do. As he's getting older, he's being very finicky with in and out and whining and being a pain in the butt most of the time, but he's still a good cat. And then we have an older lab that's about 2 years old now. Older, he's 2. That's not that old. But just this Christmas, we got a second lab puppy.
Oh.
So now we've got a new little puppy running around. So probably more of a dog person, but I respect our cat.
Yes, fair enough.
I give him his own space and let him do what he's going to do.
Yeah. Cats like that.
But I'm probably a little more of a dog person, but cats are fine with me.
Yeah. If you could invite anyone to dinner, who would it be?
Like
Dead or alive?
historical figure, or
Anyone you want.
that would be really cool to meet my great-grandpa.
What is your special skill?
My special skill, is that like a party trick, or is that just something I'm really good at?
Anything. It can be a party trick. It can be, I don't know, changing a flat tire in under 30 seconds, something like that.
So my special skill, ever since I was a little kid, I could take apart anything, but I could never put it back together again. So I remember when my mom bought this really fancy calculator one time, and it was probably like a $50 calculator, but it was a big deal. And she brought it home, and probably within about 2 hours, I had it in a million pieces. And I think I was grounded for, I don't even know how long, but that calculator never got put back together.
Yeah.
But ever since I've been little, I've just, anything I can get my hands on, I've always just wanted to take it apart and see how it works. And I think that in orthopedics, that sort of mentality and mindset has really been a big advantage for me in being able to do the type of surgeries that I want to, because there's so many times where you have to make little adjustments in putting things back together, or how you fix a problem or fix a bone. And just having that mechanical inclination ever since I was a kid, it really sparks my brain when I get a really complex problem in surgery. And I think it's the same kind of spark as a kid when I was taking things apart. So
I think that's a special skill. I think that's very good.
I try not to take people apart.
I would hope so.
Without putting them back together. So far, I've put back every patient. I've been able to put them all back together.
Thank you for joining us. Be sure to tune in next time. We'll be talking to some employees from our Davis Hospice Center.